to get the baseline to check for anything that may influence vital sign. Okay, let me go in and see my patient.
Yes, come in.
Hello, good morning. How are you doing today? My name is Abby, and I'm gonna be your nurse. May I please have your name? Can you state your name and your birthday for me, please, ma'am?
John Doe.
Okay, how do you want me to address you?
Uh,
Mr. John Doe, how do you want it?
Mr. John.
Okay, Mr. John, may I verify your wristband? Okay,
And my date of
and
birth
your date of birth?
is January 1, 1960.
All right, do you mind if I verify that on your wristband?
Yes.
I'm going to be pulling down your blanket, okay, if you don't mind. All right. Okay. All right, Mr. John, and that's the right date of birth. Okay. All right. Where are you right now?
I'm in the hospital.
All right. What brought you to the hospital?
I'm not feeling too well.
Oh, okay. And how are you doing right now, currently?
I think I feel a lot better.
Do you know what year it is?
Oh, it's 2016.
Okay. What time is it? Do you know?
Oh, I'll have to look at the clock.
I think it's about 4:10 at this time. Okay, that's fine. All right, my name is Abby, like I say, and I'll be doing some, performing some vital signs on you today and to do a head-to-toe assessment. I'm really sorry, the head-to-toe assessment, I'll be doing some touching around your body. I'm just trying to look for anything that is not that is abnormal and making sure everything is symmetrical, okay? So making sure that you're fine, and we're trying our best to make sure you feel good and take care of you in the hospital. Are you in any pain at this time?
Yes.
Where's the pain at?
Oh, at my back.
At your back? Okay, when did the pain start?
2 days ago.
2 days ago. Okay, what's the intensity of the pain? From the scale of 0 to 10, 0 being no pain, 10 being maximum pain, 5 you're in the middle. So what grade would you give your pain?
About 2.
About 2?
Yes.
All right, and is that bearable?
Oh, yes, it's okay.
Oh, it's okay. Okay, do you mind if I take a look at your back and see where the pain is starting?
Sure.
Okay, that'll be, if you can scoop up for me a little bit. Okay. All right. Is the pain right here?
Exactly.
All right. And now, is the pain radiating anywhere else, or is it just right there?
Just right there.
Okay, good. All right. I can't see no swelling here, and there is no lesion. There is no wound around there. Okay, probably maybe because you'll be lying down for a while. But we're going to get to that, okay? So the first thing, like I say, we're going to take some vital signs from you, okay? We'll be checking your radial pulse, apical pulse. Apical pulse, we listen to your heart. That's where we get the apical pulse. And your radial pulse, we check the inner aspect of your wrist. That's where we listen to the radial pulse. And we're going to check your blood pressure too. And we're going to check your temperature, okay? We're going to be using the mercury thermometer, okay? So have you had anything to eat or drink in the last 30 minutes?
No.
Okay, all right, because I'm going to be placing the thermometer in your mouth for about 3 minutes, under your tongue for about 3 minutes, and I will read it right after that. Okay, but first thing I want to do now, I'm going to roll down the allergies.
No.
No, I have no allergies, so that's good. All right, no problem. So let me check your radial pulse, okay? Are you still doing good so far? Okay.
Yes.
All right. Your pulse is 52 at this time. Okay.
Thank you.
All right, no problem. So now the next thing I'm gonna do now is to check your blood pressure. Okay, let me check your brachial artery. See where that one is. Right there. I got that one right there. So I'll check your blood pressure. I'm gonna be wrapping the cuffs around your arms, and I will inflate the cuff, and you might feel a little bit discomfort, but it's not going to take much of our time. I'm just going to inflate the cuff and deflate it, and we get the number. Okay, is that good so far?
Yes, sir.
Awesome, that's nice. Okay, all right. Let me go ahead and get my baseline. Okay, is that 0 right there? Okay, let me get the baseline. Close this out. Baseline is at 100. Awesome. All right. I'm going to deflate that. So let me add 30 to that and start inflating and get the right blood pressure now. Okay? All right. Put this one in my ears. Okay, that's the brachial artery. Blood pressure is 100/55. Okay.
Good.
All right, the next thing I'm going to be doing now, are you having any pain or any discomfort so far?
No.
I can see you well groomed. You had your shower already?
Yes.
Oh, nice. I can see the nice cut there and everything. Your skin is good on your arm. I don't see no lesion, no wound on your arm. Any surgery anywhere else or any procedure done in the last 24 hours?
No.
Okay, no problem. That's fine. All right, so the next thing I'm going to be doing now, I'm going to be checking your respiration, okay? I want to see how you breathe. Just breathe normally for me. I'm just going to I will get an access to your chest to see how it's moving, okay? I'm going to be counting for your respiration, okay? Your respiration is 21, okay? All right. Okay, so the next thing I'm going to be doing now is let me just quickly run over your temperature like I told you. I'm going to place this under your tongue, okay? And you're going to hold it for like 3 minutes, okay? Let me wash it. Wash that and I wipe it out. It's dry clean. Okay, I'm going to place this under your tongue and you're going to hold it tight for 3 minutes, okay? Then I'll collect it back from you and read it. Okay, hold it tight. Awesome. All right, I'm checking my time. Oh, 3 minutes. Awesome. Let me see what that says.
Okay, now.
Yeah, your temperature is normal. It's 35.5. Awesome. That's degrees centigrade, okay? All right, let me put that in my pocket. Okay, so like I said, right now we got all the vitals, and I know you have a pain of 2 at the back, and we're going to talk to the doctor about that. And the next thing I'm going to do, we're going to start the head-to-toe assessment. Are you ready?
Mm-hmm.
Okay, no problem. All right, so like I said, it's head-to-toe. I'm going to try as much as possible to cover everything from head to toe, just like I described, okay? And I'll be asking you some quick questions, and anywhere I touch, you tell me if you feel any pain at any point in time, you feel any discomfort, just let me know, okay? All right. And if I can have you sit on the side of the bed, okay, and I'll start doing the assessment, okay? My patient is at the side of the bed, okay? Let me start with the head, okay? All right. Okay, your head, I can see your head is pretty normal for your development age. I don't see no mass. I don't see no lesion. And the hair is fully, saturated. It's all over the head. And there's no patches. There's no dandruff around your hair. And I don't see no masses. Are you feeling any pain around here?
No.
Have you had any head trauma before?
No.
Okay, awesome. All right. Good. The hair look much healthy. Okay, the hair, I don't see, the scalp is healthy. There's no dandruff, there's no head lice. And you said you have no head trauma before. Okay, the hair is thin and everything is fully distributed. There's no alopecia, there's no patches and everything. The hair is fantastic. Okay, and I can see your face is clean. I mean, there's no wound in your face. I don't see no lesions, and everything seems to be pink, and it's not pale, and there's no cyanosis on your face. Okay, that's good. Can you take a smile for me? Oh, nice. Okay, can you frown for me? All right, we're just checking your facial nerves. Okay, you can see everything is working accordingly. Okay, now the next thing I want to do, I want to check your sinuses, your facial sinuses. Okay. Let me first of all start with the frontal sinus. Tell me if you feel any pain right here. No pain?
No.
All right. Do you have any pain in your ethmoid?
No.
All right. Let me go to your maxillar sinus. Any pain?
No.
All right. No problem. All right. Okay. So right now, next thing I'm going to be doing, I'm going to be checking your eyes. Okay. We're going to do some little eye exam. Okay. So let me first of all start from the outside. There's no lid lag. The eyes are symmetrical, eye closing, Have you ever had any eye surgery? Do you have any eye problems?
No.
Okay, I don't see no masses, no foreign thing there that is not supposed to be there. It looks pretty good. Okay, all right, now I'm gonna go in your eyes now. Okay, can you open your eyes for me? All right, the eyes, the pupils are round, and the sclera is white. Have you ever had any pink eye? Have you had any pink eye?
No.
No pink eye. All right. Do you have any drainage at night or
No.
anything?
No.
Okay, I can see the eye is pretty. So we're gonna do some peripheral. I'm gonna test your peripheral vision. So what I'm gonna do, I'm gonna come behind you. My hand is gonna come behind you. When you see the hand on the side of your eye, you just raise up your hand and let me know, or you say yes.
Yes.
Good. I'm gonna do that on this right side too.
Yes.
Awesome. All right, that's your peripheral vision is good as far as I'm concerned. So we're gonna do some extraocular muscle check of your eyes. Want to check the muscle of your eyes. So what I'm gonna do, I'm gonna have my my pen light. I'm gonna have my pen light. You know, we're gonna be checking for your extraocular muscles, okay, just to see how the muscles of your eyes are doing. So you're gonna look straight in, look this flashlight straight, okay. Follow the movement, okay. I'm gonna go up. Awesome. I'm gonna come down. Awesome. Then I'm gonna go sideways. Awesome. And I'm gonna go that way. Awesome. Then I'm gonna come this way. Awesome. Then I'm gonna come this way. Awesome. You look like the muscles are working really good over there. Okay, that's good. So the next thing we're going to do, we're going to check for accommodation. Let's see what your eyes can accommodate, okay? What you're going to do for me right now is that you're going to look straight to this pen as it comes close to you and as I bring it back out, okay? Let's go. All right, I see. Back out. Okay. So the next thing I'm going to do now is I'm going to check your eyes for I want to see consensual agreement between both eyes, okay? I'm going to be flashing light in one of the eyes to see whether the other one will constrict, okay? All right, that's good. Let me do the same to this one too. All right, this one too constrict. So the eyes is good. Do you have any eye problem? Do you have any concern about your eyes?
No.
No. Okay, all right. The next thing we're going to do now, we're going to move down to your nose, okay? Do you have any nosebleed?
No.
All right. Any sinus problem?
No.
All right. Okay. I can see the outer aspect of your nose. There's nothing wrong with it. It looks symmetrical to me. No deviated septum. And we're going to do a patency test now. I want to see how patent your nostrils are. Okay. So you're going to cover one nostril and breathe in with the other one. And tell me how you breathe, how you do on that one. Okay, cover the left one. Okay, now cover the right one. All right. Do you breathe better in one of them better than the other one?
No.
Okay, both breathing equal?
Yes.
Okay, that's good. That's awesome. I can see in distress. Your respiration is good. Okay, now I'm gonna go inside your nose now. I'll be flashing my lights there to see whether we're going to have any abnormal structure or anything in there. So if you would tilt your head forward for me a little bit.
Okay.
Over, up there. Okay. All right. You can see the inner aspect of your nose. You have a little polyp, but it's normal. It's not obstructing any air, which is normal for everybody. Everybody has small polyps, but if it's growing outside and causing some obstruction in breathing, that's when it's a major concern. So it's pretty nice and clear. It's really good. Any nosebleed, any injury, any previous injury to the nose?
No.
Any concern at this time?
No.
Okay. All right. Now I'm going to do a sensory test on your face, okay? You're going to tell me if you feel the touch, okay?
Yes.
Awesome.
Yes.
Awesome.
Yes.
Awesome. Nice. Okay, good. All right. I think I'm done with the nose now. So next thing we're going to move on to your mouth, okay? Do you wear dentures?
No.
No, you don't wear dentures. Okay, no problem. All right, let me tell you. Let me take a look at the outside. The lips is symmetrical, and can you open your mouth for me, Mel? Okay, all right. The mouth is open. Okay. Let me check your uvula. If you can say ha.
Ah.
Nice, nice. Say ha again.
Ah.
Okay, I don't see your tonsils. It's right there. I don't see no foreign substance around there. There's no discharge or anything. Your teeth is pretty good. Do you have any dental problems?
Not really.
I can see the oral mucosa is moist and pink, and the hard palate, there's no obstruction, and the soft palate right there, I can see it's good. Can you raise your tongue for me? Can you move it sideways, up, down? Okay, I'm trying to see your hypoglossal nerve to see if it's working pretty well. That's good. All right. You have any concern or anything at this time that you want to let me know?
No.
All right. The teeth, everything is right there where it needs to be. Okay, all right. So I'm done with the mouth. The next thing I'm going to be doing now, move down to your ears, okay? Do you wear hearing aids?
No.
You don't wear no hearing aids. Okay, no problem. So I'm just going to check the outside of the ear. Let me see if there's any lesion. There's no mass. There's no wound anywhere around there. The pinners are symmetrical, and they are in line with the side of the corner of the eyes, and it's not way downward like people with Down syndrome will have. So everything is in line, so it's symmetrical. That's nice. Okay, good. From the outside aspect, everything seems to be good. Do you feel any pain as I'm touching?
No.
No pain? No pain?
No.
Okay, all right. This is in my hand. All right, now I'm going to go inside the ears. I'll put my otoscope. I'll grab an otoscope and check the inside. I want to check your tympanic membrane, your eardrum. Okay? All right. You say you don't wear no hearing aids?
No.
Okay, no problem. Let me flash light. Let me flash light in there. The inside is gray, which tells me it's healthy. I can't see no drainage, though there's a little bit of cerumen in there, like earwax. I can see a little bit. That's not a major concern. So I'm going to check the other side too. Everything looks good in there. Let me go ahead and check the other side. The other scope, yeah, put it down. This one too is gray. It's pretty much like the other one. There's no drainage, no obstruction. I can see a little bit of earwax. And it looks healthy. Okay. Any pain so far?
No.
All right, no problem. So the next thing we're going to do, I'm going to perform a Rene test and a Weber test. This is just to check, to test production, okay? So the Rene test, I'm going to grab a tuning fork. I'm going to strike the tuning fork, move it closer, very perpendicular to your right ear, and you're going to tell me when the sound stops, okay? You tell me when the sound stop. Okay, good. I'm going to do that on the other side too. Okay, let me just go over. Tell me when the sound stop.
Stopped.
Okay, nice. I see that it's within range. It's within the number of times that it's supposed to stop. Okay, and then the next thing I'm going to do is the Weber test. The Weber test, I'm going to strike the tuning fork, place it on your head, and you're going to tell me where you hear the sound from. If you hear it on the right side more than the left side, or maybe it's both sides is balanced. Okay, let me strike the tuning fork to get the Weber test. Tell me, where did you hear it? Is it on both ears?
Yeah.
Okay, awesome. That tells me that your hair is good. All right. So the next thing we're gonna do, we're gonna move down to your neck now. Okay, how are we doing so far?
So good.
So far, so good. All right, we're gonna move into your neck. Okay, let me first of all palpate your carotid artery. That's right, that's good. Blood supply is good. That's also good. Let me go ahead and check the lymph nodes around your neck. Tell me if you sit down like this. Okay, and
no.
All right, no problem. So the next thing we're gonna move down to your. I'm gonna.
I stopped. Did you check?
No. Let me finish with the extremity. I'll come back to the chest.
Okay.
And the abdomen.
Okay.
I'm doing it systematically, so because everything's going. I've said we are moving to the extremity. Okay.
Okay.
All right. let's go to the extremities, okay? So first of all, let me check your femoral artery simultaneously, okay? Now I'm gonna provide the privacy for my patient and cover my patient up right here on this side. Let me move the gown up, okay? All this way. So this is all I need. Checking the femoral artery. Good. Then we're moving downward. Cover my patient up. We're moving downward. So I'm going to check the popliteal. Good. All right. Let me go to tibial. You have a wound right here. How long have you had this wound?
About 3 days.
About 3 days. Is he healing properly? Is he doing well?
Yes.
Okay, you've been taking your meds?
Yes.
Okay. How's the pain right there?
Not a lot.
Not a lot? Okay, good. All right, no problem. So I'm going to be gentle on that area. Okay, so what I'm going to check now, I'm checking your dorsalis pedis pulse simultaneously. Oh, good. So we're going to check your posterior tibialis. Good. All right, let me check your capillary field on the toes. 3 seconds. Less than 3 seconds. 3 seconds. Yeah. All right, good. We're going to do some reflex too on the lower extremity, okay? We're going to do patellar reflex, okay? I'm going to strike the hammer right here, and I'm expecting the two-way movement, okay? All right, if you can flex your knee for me. This is your patella. We call it patella. It's knee. Okay, I'm going to strike it with the hammer. All right, good. That's a good reflex right there. Let me try the other one. All right, good reflex. And we're going to check your Achilles reflex too, right here. The ankle, I'm going to strike the hammer here. I'm expecting some kind of a reflex. Two-way reflex. All right, awesome. Achilles reflex. Now we're going to do some plantar reflex, okay? Let me see. We're going to perform some plantar reflex. Okay, I'm covering my patient up. I'm not exposing my patient. Okay, so we're going to do some plantar reflex. So I'm going to strike something under your foot, okay? And I'm respecting the dorsal reflex, okay? All right, this is coming down, okay? So it would have been Babinski if your foot happened to fan around, but it's responding the right way it's supposed to respond. Good. All right, let's try it on the other one. All right, awesome. So everything is pretty good on your lower extremity. Do you have any problem at this time?
No.
Any pain, any discomfort?
No.
You let me know. You can just stop me. Okay? All right, now I'm going to go and listen to your lungs. Okay? I'm going to listen to your lungs, and also I'll listen to your apical pulse. Okay? How we do the apical pulse is we're going to check your pulse right around where your heart is, okay? All right? And let me do that before I start any other thing right there. So I'm going to cover my patient. Okay, so suprasternal notch. Okay, 5 intercostal down. 1, 2, 3, 4, 5. Right here, I got it. Left to the midline. All right, right there. I'm going to place my stethoscope right there and count for a full minute. (101), okay? All right, the apical pulse is 101. All right, so the next thing I'm going to listen to your lung sounds, okay? Let me start with the apex of the lungs, okay? You're going to take some couple of deep breaths for me, okay? All right. Take a deep breath. Take a deep breath. All right. Take a deep breath. 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 Awesome. So we're going to do the lateral side, okay? I'm going to roll this up on your side. Take a deep breath for me. Take a deep breath for me. Awesome. So we do the same on the other side. Okay. Take a deep breath for me. Take a deep breath for me. Awesome. All right. So now I'm going to be listening to your aorta, and I'll listen to your pulmonic and your ERB's point and your tricuspid and mitral. Okay. All right. And this is the sternum. To the right of the sternum, this is your. To the right of the sternum, this is your aorta. There. This is your pulmonic. That's the second intercostal space. Then we'll move on to the third intercostal space. Right here, that's your ERB's point. And we move down to the fifth intercostal space. This is where we have your tricuspid and the mitral. Awesome. All right. So we're going to listen to your lung sound at the back. Okay. I want you to scoop forward for me a little bit. Scoop forward so I can listen to your back. Are you okay at this time? Do you feel any pain? Okay. You're gonna give me some couple of deep breaths. Okay.
Okay.
Okay. Hold on a second. Let me put this my start my hair. Okay. So you're gonna take a couple of deep breaths for me. Take a deep breath. Take a deep breath. I'm making sure it's not on the bony prominence, okay?
Okay.
Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath. Awesome. So what I'm going to do is what we call a chest excursion, okay? I just want to see the expansion of your chest. If you can come down, let me show you how we're going to do that, okay? I'm going to go behind you, place my tongue. So place my tongue somewhere around the spine area here. And you're going to take a deep breath. And down. Both thumbs, move up symmetrically and came down symmetrically. So the chest wall is rising and falling the right way it should be. Okay, thank you so much. Okay, so we're going to do some percussion right now. Alright. The sound is dull around there. That's where we have our lever somewhere here. And we're going to do the same at the back, okay? If you don't mind, Mr. Do. Alright. The sound is good. It's the kind of sound we want. If you can move up the bed a little bit, okay? The sound is good. It's the kind of sound we want. So now, do you have any problems, any heart disease or any problem with your heart?
No.
I can see you're breathing fine now. I don't see, although I've troubled you a little bit, but I can see you still comfortable. Okay, just let me know anytime you feel any discomfort, okay?
Okay.
And I'll start, okay? All right, so right now, we're going to move down to, I'm going to do some palpation. You're going to tell me if you have any pain, okay? Any pain here?
No pain.
Any pain here? Any pain here?
No pain.
Any pain here?
No.
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 Any pain?
No.
Any pain? Awesome. And I can see the skin around all this area is good. It's not pale. There's no cyanosis. It's pink and you're healthy. Okay? So the next thing we're going to do, we're going to listen to your bowel movement. Can you tell me a little bit about your bowel history? Do you go to the restroom normally?
Yes, I just went today.
You just went today? Awesome. All right. Any stress in, having bowel movement?
No.
How about your urination? Have you been urinating pretty good?
Yes.
All right, no problem. So I'm going to listen to your lung sound, to your bowel sound, okay?
Okay.
I'll listen to all the quadrants, okay?
Okay.
Fine. The stethoscope is going to be a little bit cold, okay? All right. Okay, I'm inspecting. I don't see no distension. The belly is flat, which is a good thing, okay? All right, I'll be placing the stethoscope from the lower abdominal area come upper, go that way, and go that way, okay?
Okay.
Alright. And then we're going to listen to each quadrant for a full minute. Okay. 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 Okay, the vowel sound is present in all those areas. Okay, now I'm gonna do a little light palpation. Okay, you tell me whether you feel any pain. Okay, all right. Any pain here?
No.
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 All right, we're gonna do a deep palpation now to see if the organ are where they need to be. Okay, and I'm gonna also listen to the kidney artery, the iliac artery. Around here, the kidney is around here. I'm going to listen to the kidney artery and the iliac artery here, okay? Let me listen to that real quick before we move further, okay? Good. 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 All right. Let's do a deep palpation right here. When you do deep palpation, you're going to go like that. Support with this finger. Alright, I see your liver right here. Now I see where the kidney is. Okay, the kidney's right there. Alright, do you feel any pain as I'm pressing?
No.
Alright, any history of appendicitis?
No.
Okay, good. Alright, the stomach, the abdomen looks healthy, and the bowel sound are present in all quadrants. And you say you have no problem with having bowel movement, right?
Yes, sir.
Okay, all right. So I guess that's it about your head to toe assessment. I hope I covered everything. And do you have any concerns, any complaint, any problems, or anything you need to let me know?
No.
Okay, all right. Right now, at this point, I'm gonna, make my patient. I'm gonna make my patient comfortable. I'll provide safety by raising the side rails. Okay, and put the patient in the comfortable position. Okay, I'm gonna move the blanket back up and cover my patient back. Sure, you have any problem at this time, ma'am?
No.
Okay, all right. So that's it about the head to toe assessment. All right. And for the pain, I'm gonna let the doctor know that you're hurting at your back, okay?
Okay.
And we can provide you something for pain. Okay, now it's time for me to go and document my findings into patient chart. And I'm gonna sanitize my hand the way out. And I put the call light within reach for you. Okay, if you have any problem,